Hi, my name is Dayanara Torres, and I'm going to talk about embolization of stones for an inferior vena cava filter. Definition. What is embolization? Embolization is a procedure that uses particles, such as tiny gelatin sponge or beads, to block the blood vessels. This embolization may be used to stop bleeding or to block the flow of blood to a tumor.
Embolization is the technique of blocking abnormal blood vessels. There are several ways to block a vessel. We could use particles, liquid agents like glues, or special coils. Embolization is indicated to block a vessel that is bleeding after maybe an accident. It could be used to reduce the blood supply of a tumor before surgery. It also finds use in the treatment of abnormal clusters of blood vessels. For example, in a case that is bleeding from the intestine, a tube is first taken from a puncture made in a blood vessel of the leg into the blood vessel close to the point that is bleeding. This is done under image guidance. Then through this we pass another smaller tube so that we can reach the very site that is bleeding. Then we use multiple platinum coils to block the vessel, curing the patient or stabilizing the patient completely. Embolization is a revolutionary technique which can be life-saving in several situations. It is performed under local anesthesia, and often the patient can be discharged in a day or two.
What is inferior vena cava filter? Is a type of vascular filter, a medical device that is implanted by interventional radiologists or vascular surgeons into the inferior vena cava to presumably prevent life-threatening pulmonary embolism.
You cannot be anticoagulated and had presence of deep venous thrombosis. We access the common femoral vein in a standard fashion with a mini stick needle followed by the wire micropuncture sheath. We then advance a wire into the inferior vena cava and a sheath is introduced. This sheath is used to perform a venogram. This venogram is done to better delineate anatomy. Demonstrated here is the venogram performed, which shows the lowest renal vein. Inferior vena cava filters are placed below the lowest renal veins and above the confluence of the iliac veins. Contraindication to placement of IVC filters are a diameter of less than 15 mm and above 30 mm. A dilator is advanced to this sheath and the sheath is then gently advanced so the tip of the sheath is at the level of the lowest renal vein. The dilator is subsequently removed from the sheath and the filter is then advanced through the sheath. Once the filter hook is advanced to a level of lowest renal vein, the sheath is gently retracted over this IVC filter. The filter is then subsequently deployed as demonstrated here in this video. A completion venogram is then performed that shows adequate deployment of filter just below the renal vein and above the confluence of the iliac veins. This concludes our video demonstration of inferior vena cava filter using a Cook Select filter.
Applications in medicine. Actually, there are two types of IVC filter. First is the optional filter. The optional filter are designed to be retrieved or left in place after the risk. And the second one is the permanent filter. The permanent filter have been used in patients with a long-term need for mechanical prophylaxis. Pros and cons. Pros: the inferior vena cava filter can be retrieved with endovascular interventions, and medicine can be used to relieve the pain. Cons: chronic edema of the lower extremities and post-phlebetic syndromes and long-term complications. Issues applies in Ecuador. In Ecuador, there are many cardiologic centers and doctors that perform IVC filter, like Carabu Cardiovascular Institute and the Institute of the Ecuadorian Society of Cardiology. Conclusion: the insertion of an inferior vena cava filter is indicated in patients with pulmonary embolisms where anticoagulation is contraindicated or fails. Thank you.